Making the mind-body connection. Understanding the connection between physical symptoms and mental health issues is critical to getting the help you need. Mental health plays a huge role in our overall well-being. Just as good mental health positively affects our physical health, poor mental health can also take a toll on our physical well-being. What most of us do not know is that mental health issues often show up as physical or physiological symptoms. Mental health issues, including stress, mood, and anxiety disorders, if left unidentified and untreated, can cause immeasurable suffering. Building awareness around the connection between mental health issues and physical or physiological symptoms is a key to diagnosis, treatment, and healing. Preventative care is about understanding when we're not feeling good in our body. Are there factors that are going on right now that I need to pay attention to and address in order to get myself back on track to a healthy well-being and managing the control I need to feel good in my physical health as well as mind, body, and spirit? Our mental and physical well-being are all linked. Taking care of ourselves requires seeking help for our symptoms as they show up. Don't let things lag. Many of us do have a tendency to take an Advil, push things aside, push through. Oftentimes, we're not doing ourselves any advantages by denying the relevance of physical and psychological conditions. When we're not feeling optimal and when our symptoms become problematic and troubling, or interfering where we need to take supportive over-the-counter supplements or medications, sometimes it's good to pay attention on a preventative care factor and seek the help of a doctor. Most of us, with our first point of contact of getting treatment, is we go to our family doctor or general practitioner. But with the hustle bustle of our rat race of a life and being so overstretched with home, work, personal responsibilities, and relationships we maintain, oftentimes we do have a tendency to dismiss physical symptoms that many times are coming from deeper places that need to be addressed. Mental health issues manifest as physical symptoms. It is important to recognize how many times our chronic physical conditions have an underlying mental health concern or cause. Depression, chronic stress, and anxiety can manifest as sleep issues, including insomnia or sleep apnea. They can also show up as muscle tension, soreness, chronic fatigue, gastrointestinal issues like stomach pains, loss of appetite, abdominal distress, or digestive irregularity. People with trauma and stress can trigger autoimmune disorders like psoriasis, eczema, arthritis can get worse. And many times people with panic attacks find they have physical symptoms of heart racing, nausea, chills, shortness of breath, chest pain, dizziness, numbness, fatigue. It is important for us to recognize the importance of our physical symptoms and are there underlying other causes for it. In the throes of a panic attack, people feel as though they're having a heart attack or a near-death experience because it's a number of physical symptoms all peaking and dropping in an intensity that we feel a loss of control over ourselves. These panic attacks are so frightening and many times we worry about having another one. It is important to recognize even though it's a number of physical symptoms all peaking and dropping, it is coming from a psychological cause, panic disorder. The undeniable connection. It is important for us to recognize that there is a connection between our mind and our body, and that many times we go to the doctors over and over for physical complaints, but we don't often share the psychological things that are happening in our life that are impacting our mental health. We go through so many stressors in life with raising children, children going through struggles, parents aging, job stress, competition at work, feeling like we're not focusing or doing enough at work. Many times we're competing with ourselves and others, we're being hard on ourselves, and we don't recognize the accumulated effect of chronic stress, chronic fatigue, overworking, overstretching, feeling behind all the time and not being able to manage. Due to the lack of understanding of the possible connection between physical symptoms and mental health issues, patients don't realize the importance of sharing what's going on in their lives as a way to address symptoms. Physicians today do need to have a little bit more time or a little bit more information from ourselves to know what's going on and understand the factors in play in our lives. It is important due to the tremendous time constraints. I know many of my patients complain that I don't get more than 5 or 10 minutes with my family doctor, and I feel rushed to bring everything on the table. And so the first thing they bring up are all the physical complaints. And then what happens? You usually get a bunch of medical labs and tests that are physically looking for something wrong. But many times, if we take a few more minutes to share also what's going on in our lives, your primary care physician can get a better picture of the stresses and factors that are playing in our lives that could indicate psychological stress and psychological conditions that are coming out and causing you physical complaints. Due to the lack of understanding of the possible connection between physical symptoms and mental health issues, many patients do not believe or recognize that their life situations are causing their symptoms. It is important to understand this. And again, many times we go to physical tests and battery of different medical tests in order to try to make sure that we're not missing a diagnosis that is very underlying harmful and dangerous. We don't always realize that sometimes the stress is something deeper, and it could be psychological, like an anxiety disorder or depression. This is where I think it's important for each and every one of us to understand the mind-body connection. And when we do go see professionals, we not only share our physical symptoms, but we start providing concise and relevant information to our healthcare professionals about psychological things that might be impacting our life, such as chronic stress at work, feeling pressured to overwork to meet a deadline, or family mental health issues, or parents aging and going through medical tests, or dealing with children that are struggling in school right now and feeling overstretched with not getting enough time to rest or sleep or manage life. In my clinical practice, I really do stress the importance of awareness. The first step to treatment is always awareness. And this is understanding the interconnection between all your symptoms. I try to explain to my patients that all your problems, regardless of what's going on in your life, stress, anxiety, marital problems, money stress, children, caregiver needs, self-esteem issues, whatever's on your table of problems, they manifest in 3 distinct ways: physical or physiological symptoms, negative, persistent thoughts, and maladaptive, unhealthy behaviors or lifestyle habits. The interconnection of these symptoms keep your problems standing in your life, and it is important for each and every one of us to start communicating not just the physical symptoms, but sometimes what are the lifestyle habits I'm doing, what are the negative thoughts that race in my head, and what are the stressful, problematic situations that are happening in my lives: divorces, breakups, struggling with dating online, feeling alone in our lives, isolated, overworking or underworking, or feeling loss of motivation and drive and not being able to manage our day-to-day, hygiene or taking care of our family or ourselves. You need to take a more active role in your health visits. Let's take a mindful moment right now as we take an inhale and exhale. In this mindful moment, reflect on your life. What are some of the physical complaints that you get when you are stressed out and going through stressful situations in your life that also impact your mental health? Let's take a moment right now and reflect. What are some physical complaints that I get when I'm stressed out with work or home or relationships or have a fight with my partner or my parent? Let's reflect right now and have some understanding of where are the first couple of points of body stress that you carry tension in. Is it abdominal distress? Is it muscle tension? Is it headaches? Is it shortness of breath? Let's all reflect right now on some of the points that I'm bringing together today with the mind-body connection. Let's take a deep inhale in and breathe out. Another deep inhale in and breathe out. Follow your breath and reflect on the connection between your physical or physiological symptoms and how they arise when you're going through problems, and how they can sometimes cause mental health issues of anxiety, sadness, fear, self-doubt, worry. Take a moment right now and reflect. If your mind tends to wander, gently bring it back to your breath and reflect again on how you can take more of an active role in your healthcare visits. How you can talk not just about physical symptoms, but sometimes also sharing what's going on in your life. As I gently bring you back from this mindful moment, another gentle reminder: you can take a more active role in your healthcare visits. Ask questions, and even though some of those visits are rushed, tell your doctor what is really happening in your life, not just communicating your physical symptoms, but try to explain to them times of trouble or times of stress that you might be going through just with the phase of life you're in, like grief, a divorce, a breakup, or an unusually stressful time with deadlines or work stress. If you feel you need the help of a mental health professional, ask for a referral. It's better to have somebody meet you and explore by assessing your symptoms accurately than you denying physical or psychological issues by blaming physical symptoms as just being physical. You need to take a more active role in your life and see the interconnection between physical symptoms and negative mental health symptoms. Your doctor is there to help, and it's the first line of treatment we go to. So the more we can advocate for ourselves and communicate clearer about what's really going on, the sooner and better we are able to let our doctors do the work that they need to do to assess and appropriately refer for treatment or medical tests. Please take charge of your health. Understand communicating your symptoms is very important, but acknowledging your symptoms is the first step to treatment. Connecting the dots. When seeking treatment for your symptoms, it is always important to understand that there is an interconnection between physical or physiological symptoms and mental health concerns that come from stress, anxiety, or depression. Be aware of the ways that mental health issues can manifest as physical symptoms. What are your top 3 areas of physical symptoms that show up whenever you're stressed? We each have our own little cocktail of goodies, and it's important for us to recognize, how do I recognize stress in my body? Is it tension in my body, headaches, shortness of breath, abdominal distress, eczema, psoriasis? Take an exploration of your own symptoms that pop up when you're stressed out. Make sure your doctor knows what's happening in your life, whether it's breakups, transitions, stressful periods with exams. It is important to share with your doctor life transitions and how they may be causing you stress, as well as impacting your physical condition. Seek the help you need when you realize you need it. Don't play wait and see, as many times by not addressing things just get worse. Communicate any life-challenging circumstances with your doctor that you may feel is impacting your health. And please request a referral to a mental health specialist if you feel you need it. They often can provide both accurate assessments and a follow-up treatment plan that is helpful to not only address your physical complaints, but also your mental health stresses, and give you even better coping ways of managing instead of feeling like you have to endure distress and just push through it. Let's take charge of our treatment. Let's take charge of our health.